Hi everyone, Aisha here. Thanks for joining us for the second instalment of our vlogs all about neonatal reflexes. So today we're here to talk to you about the rooting and the sucking reflex. So firstly, the rooting reflex. This one assists your baby in being able to find mum's nipple and then latch on with breastfeeding. So it's activated by gently stroking their cheek, moving towards the corner of the mouth. Now you can test this using either your fingertip gently or using a soft brush or something like a makeup brush. And all you do is start from the top here, just below the eye, and move down towards the corner of the mouth. And then the next one is starting from the jaw and then moving up towards the corner of the mouth again, and do the same on both sides. So what we're looking at when we do this test is if the baby turns towards the side of stimulation, that's a positive that that reflex is still there. Or sometimes in older children, it can be as simple as the corner of the mouth lifting up, like a little bit of a smile when you stroke that same side of their cheek.
Yeah. He opens his mouth, so that's a positive.
Now these responses, they should be equal from left to right when we test them. And they should be integrated from around 4 months old. So if your baby, your child is over 4 months old and still has this reflex, then that's a sign that they haven't integrated that yet in their brain. Now the second one that we're looking at today is the sucking reflex. So this one assists your baby in being able to effectively draw milk out of the breast when they are feeding. Now, when the child is doing a good suck, it should be a deep suck that draws the nipple deep back into the mouth. It shouldn't be a superficial suck like what we see Maggie Simpson doing with her dummy when she's more pushing out. Now this one can be tested by gently pressing the roof of the mouth, and that's when the baby will start to do that sucking, drawing the finger back there. You have to be gentle when you're doing this one and also careful of finger placement. If you go too far back into the mouth or press too firmly, sometimes it might elicit what we call a gag reflex. Now the sucking reflex should also be integrated from about 4 months old. And again, if you notice that this one or the rooting reflex are there past the age, then that's an indication that that reflex has not yet been integrated by the higher functioning areas of the brain, and might be a little indication that there's something else going on, or maybe there's some kind of developmental delays happening. Thanks again for joining us for our second instalment of our little series on neonatal reflexes, talking about the rooting and the sucking reflex. And stay tuned for our next one, which will be talking all about the Moro reflex. I hope you've enjoyed this one, and we'll see you next time. Bye!